Welcome to my presentation on ethical behavior in health information management for Health Information Management 1800C with Professor Julie Shea, Summer 2018 by Keela Herman. What is ethics? According to the Markula Center for Applied Ethics, ethics is based on well-founded standards of right and wrong that prescribe what humans ought to do, usually in terms of rights, obligations, benefits to society, fairness, or specific virtues. More simply, ethics is the study of moral principles, theories, and values. In health information management, ethics involves decision-making needed to deal with competing perspectives and obligations of the people who share a common problem. Why is ethics important to health information management? Most health information management professionals do not have direct patient contact, but we do have contact with information that affects them. We interact with their information in terms of coding, data quality, release of information, and more. HIM professionals have contact with sensitive information. How we handle that information may have severe consequences for the HIM professional as well as faculty and patients. The HIM professional is obligated to conduct oneself in a manner that reflects ethical principles and ethical guidelines and values. Core ethical principles. Altruism, the belief that others are more important than an individual. An example of altruism would be organ donation and the act of providing an organ to a complete stranger. Autonomy, an individual's right to self-determination. Autonomy is a patient having the right to decide what procedures they will or will not undergo. Beneficence, promoting good for others. Beneficence, an example of that would be releasing a patient's medical records in a timely manner so that they can receive care. Consequentialism involves considering the consequences before making a decision. HIM professionals must understand that certain codes receive a higher reimbursement, but the consequence of miscoding could result in fraud or abuse charges. Core ethical principles continued. Deontology, the responsibility guiding the decision based on action and not the end result. This would be a HIM professional having to follow policy strictly, even though other people might make an exception. Egoism involves only considering oneself in the decision-making process. Donating blood is a charitable thing to do, but if the only reason you're donating blood or donating plasma is to get the money, then that's a type of egoism. Least harm is choosing a situation that does the least harm when neither choice is ideal. And utilitarianism provides the greatest benefit to most people. So that will be our organ donation program where we procure organs for people who are in need. Ethical foundations of HIM. Ethics have been important to the foundation of HIM since 1923. The first ethical pledge was presented in 1934 by Grace Whitting Myers. HIM professionals have an obligation to protect patient privacy, confidentiality, and the security of patient records. HIM professionals are guided by the ethical foundations of privacy, confidentiality, and security. Privacy is the right of the patient to control what health information management is released. Confidentiality requires health professionals to protect health records. Security is the means to control and protect access to those health records. A HEMA Code of Ethics. The Code of Ethics serves 7 purposes. To promote a high standard of health information management practice, to identify core values on which the health information management mission is based, to summarize broad ethical principles that reflect the profession's core values, to establish a set of ethical principles to be used to guide decision-making and actions. It also serves the purpose to establish a framework for professional behavior and responsibilities when professional obligations conflict or ethical uncertainties arise. Provide ethical principles by which the general public can hold the health information management professional accountable. And it serves to mentor practitioners new to the field of health information management's missions, values, and ethical principles. Health information ethical problems. The AHIMA Code of Ethics is essential in guiding the health information management professional in problem areas. Documentation and privacy. It is the health information management professional's responsibility to ensure documentation is accurate and timely. The health information management professional must follow the laws and regulations regarding documentation to ensure the integrity of patient information. As technology advances, new challenges are presented when protecting patient privacy. Health information management professionals are critical in maintaining privacy standards as well as educating other professionals in the facility about how to protect personal health information. Release of information. The health information management professional must ensure that all requests for records are accompanied by valid authorizations. The HIM professional must disclose the least amount of information necessary to perform the service or task at hand. Coding. Health information management professionals must be guided by ethical principles when coding. Codes are associated with reimbursement rates. Unfortunately, providers may ask a coder to code incorrectly to receive a higher payment. The coder must apply accurate coding practices and assign the report codes that are consistent with what's reported in the medical record. Quality management, decision support, and public health. The health information management professional must advocate for the interest of both the public and the individual. Managed care. Managed care helps control costs. However, patients may get less standard care if physicians miss signs that the patient needs more than what's typically provided to others people with a similar condition. Sensitive health information. All information must be protected. However, some information like genetic information, adoption, drug and alcohol, and sexual health and behavioral health must be handled with extra care. Sensitive information has special regulations concerning its release. Federal and state legislation provides guidelines of which the health information management professional must be aware. However, legal counsel may be needed. In summary, the health information management field is quickly growing and ever-changing. To meet the needs of healthcare facilities, providers, and patients, health information professionals need ethical decision-making skills. A code of ethics does not guarantee ethical behavior, but it sets forth guidelines to which a health information management professional can aspire. The AHIMA Code of Ethics reflects the commitment to uphold the profession's values and to act ethically. The AHIMA Code of Ethics is used by AHIMA members, consumers, organizations that choose to adopt it or use it as a frame of reference. This presentation was created using the following references.